This is not acne. So what is it? This is actually called folliculitis. Hey guys, I'm Dr. Laura Soong, board-certified dermatologist. Welcome to my channel where I talk about all things related to dermatology and skin. If you're new here, make sure you hit the subscribe button and the notification bell so you don't miss any of my future videos. So what is folliculitis? This is essentially inflammation of the hair follicles, and it leads to a rash that looks like acne, but it's not. It's usually more on the torso, so the upper chest and the back, as well as the tops of the arms, as opposed to the face where acne tends to happen. And it usually shows up as these very inflamed pimple-like spots, so papules, as well as pus-filled bumps called pustules. The important thing to note in folliculitis is there's no blackheads and there's no whiteheads. Now, because it's inflammation of the hair follicles, it shows up in areas with lots of hair. So usually the beard area in men, it can happen on the chest and upper back, as I mentioned, as well as the lower legs and even the groin and the armpits. So let's talk about what causes folliculitis. I like to break it down into infection-related causes and non-infection related causes. So in terms of infection, common things are things like bacteria, which can be Staph aureus, which is very common, hot tub folliculitis, which we'll talk a little bit more about, yeast and fungi, so things like Malassezia, which is the same yeast that causes dandruff, and less commonly things like viruses and even parasites, for example, scabies. Situations where it's not related to infection would be things like irritation or friction, for example, from shaving, occlusion, so you're always wearing like a hat on your head and it's causing blockage of your hair follicles, or tight shirts that cause friction and rubbing there. Or it can be drug-induced, for example, anabolic steroids or even prednisone, for example, or high-dose B vitamins, so B12 and B6 are common culprits. Let's talk a little bit about these different types of infectious folliculitis. So Staph aureus is a common bacteria that lives on our skin, but sometimes it can get into the hair follicles and cause more growth of bacteria and basically inflammation and an infection. People often explain these or describe these as boils in the skin. And so these are often painful. It usually spreads quite quickly. It's usually on the scalp, behind the ears and neck, in the armpits, groin, or on the chest and back. And the important thing to know is it is contagious. So it can spread from person to person within the same house. Let's talk a little bit about hot tub folliculitis or whirlpool folliculitis. This one's kind of interesting because it's caused by a bacteria that likes to contaminate water sources, and usually warm water where it's easier for bacteria to breed and grow. It usually happens within 8 hours, up to 5 days after bathing or swimming in a contaminated hot tub or whirlpool. And the rash usually starts as these little follicular-based bumps all over the torso, the arms and legs, areas that were submerged in the water, and tends to be worse in areas that were covered by the bathing suit because that's where the bacteria get more trapped and cause more inflammation. Now let's talk about this Malassezia folliculitis, or this type of folliculitis caused by a common yeast that lives on the skin. You might have heard about this. Often people refer to it as fungal acne because it can happen on the forehead or the face and mimic acne, but it can also show up on the upper chest, the back, as well as the sides of the arms. And it usually shows up as these really small, what we call monomorphic, so all the bumps look pretty much the same, bumps on the skin that tends to be really itchy. And often it happens in areas where you sweat because the yeast really like to feed on your sweat and oil. Let's go over some other causes again. So things like irritation, friction, ingrown hairs, shaving, or those annoying razor bumps, as well as occlusion like tight clothing or thick moisturizers can all contribute. So with that in mind, let's just talk about some basic treatment measures you could start at home if you have folliculitis. So the first thing you can do is you can try an antiseptic cleanser. So usually I recommend something like benzoyl peroxide or Hibiclens, and I have some examples on the next slide. And you would use this all over your body, kind of like a shower body wash. You would massage it in on wet skin, anywhere that you have the bumps, let it sit for 5 minutes or so, and then rinse it off. And do that every day for about a week to see if that helps. The other thing I recommend is if you're getting this a lot in areas that you're shaving, switch to a different hair removal technique, such as laser hair removal, or try some simple things like switching to an electric razor or use a shaving gel. I also recommend you shower after working out or swimming in a hot tub to rinse off any potential bacteria, and avoid thick moisturizers in areas where you break out. For example, don't use Vaseline pain or something thick in those areas. The other important thing is just make sure you see your doctor to make sure it's not an infection like we talked about. And here's some examples of those antiseptic cleansers I mentioned. So Panoxyl, this is 10% benzoyl peroxide, Hibiclens over here, which is chlorhexidine, and then Trisan wash. Any of these would do the trick. Well, guys, that's it for this video. Make sure you like, comment, and subscribe, and stay tuned for more videos like this one.